Merci, professeur Verbeek. Majesté, Excellence, Mesdames, Messieurs, après ces deux premiers exposés mettant en perspective de nombreuses propositions pour améliorer la santé de nos aînés, nous allons entendre maintenant la professeure Emily McDonald de l'université McGill au Canada. Emily McDonald est professeure agrégée de médecine générale en médecine interne au Centre universitaire de santé de McGill à Montréal. Elle est vice-présidente de la qualité et de la sécurité pour le département de médecine et chercheuse à l'Institut de recherche du Centre universitaire de santé. La Dr McDonald a suivi une formation en recherche postdoctorale dans le programme d'efficacité clinique à l'École de santé publique de l'Université d'Harvard et détient une maîtrise en épidémiologie. Elle est directrice du réseau canadien pour la pertinence et la déprescription des médicaments, élément fort important, comme vous le savez, pour les personnes âgées, financé par Santé Canada et a reçu plus de 20 millions de dollars en subventions de recherche des instituts de recherche en santé du Canada. Elle est soutenue par le Fonds de recherche en santé du Québec et elle a publié plus de 160 articles sur le sujet de l'utilisation appropriée des tests et des traitements, notamment bien sûr chez les personnes âgées. Le titre de son exposé sera « Santé mentale et personnes âgées, l'ABC d'une prescription appropriée en Belgique et au Canada ». Chers collègues, vous avez la parole.
J'adore un congrès bilingue. Maintenant, je vais le rendre trilingue. Good morning, everyone. Thank you so much for inviting me to speak on the topic of appropriate prescribing and the mental health of older adults. Je voudrais tout particulièrement remercier Son Altesse Royale la Reine, les Académies de Médecine et les docteurs Spinowin et Petrovich pour leur invitation à présenter sur le sujet. C'est un sujet très, très important et souvent oublié. So my name is Emily McDonald. I'm the director of the Canadian Medication Appropriateness and Deprescribing Network. Regarding my disclosures, I have funding from Health Canada for the conduct of trials, and my network, mon réseau, that I'll be speaking about today is funded by the government, by Health Canada. And I'm the founder of a software called MedSafer that helps guide older adults and their practitioners through the process of deprescribing. Today, I'm going to be speaking to you about the appropriate use of medications and the impact that this has on the mental health of older adults, how my network has approached this issue, and the path forward for Belgium. It's important to understand that appropriate prescribing encompasses people who don't have access to the medication, the affordability of the medication, but also overuse. And so today, in our 20 minutes together, I'm going to be focusing on overuse and deprescription, but of course, appropriate use is a whole spectrum. So I'll start a bit by talking about our two countries and the similarities. So we both speak in two official languages, in Canada, French and English, and here, Dutch and French. Our countries both provide universal health care in two languages. We both have high age-adjusted spending. We also have similar life expectancies for men, about 80 years old, and for women, a little longer, about 84 years old. There are some differences between our countries, of course. Canada is geographically huge. We are 9.9 million square kilometers, whereas Belgium is 30,000 kilometers squared. Our population is a little bigger at 40 million compared to here, which is about 12 million. However, Belgium has twice the number of hospital beds for every 1,000 inhabitants as in Canada. And in Belgium, you have more than twice the number of physicians for every 1,000 inhabitants. Like many countries in the world, we both have an aging population. And so we face similar challenges. And one of those challenges is how we use medications for older adults, and that's what I'm going to speak about today. So we have discussed already that by 2030, 1 in 6 people will be over the age of 60 years old. As organizers and attendees of this symposium, you understand that older adults are extremely valuable, respected members of society. This is true, of course, for both our countries. Older adults contribute as workers, volunteers, mentors, community leaders. They are keepers of history and wisdom, and they are, of course, beloved members of our family, and they help raise new members of our families. Many older adults remain healthy throughout their life, but some are vulnerable, And with age, there is a risk of accruing more chronic health conditions, frailty. We heard about an increased risk of anxiety, depression, and also loneliness today. And of course, with the diagnosis of dementia, this can be accompanied by behavioral symptoms. And some of these symptoms are treated with medications, sometimes appropriately, but sometimes inappropriately. It's really this combination of factors that places older adults at an increased risk of what we call polypharmacy. So la polypharmacie, qui est la prise de plusieurs médicaments. And related to polypharmacy, there is an increased risk of taking potentially inappropriate medications. Ça veut dire des médicaments où peut-être les complications sont plus que les bénéfices. So for example, I'll be speaking about psychotropics today. These are medications that are used to treat the symptoms of anxiety and depression, but they can also be used to treat the behavioral symptoms of dementia. These are medications that you'll be familiar with: antidepressants, anxiolytics, antipsychotics. And although certainly some people benefit from these medications, there are also many people who are prescribed these medications who are being harmed by them. They can be inappropriate. First of all, not everyone who receives these medications has relief from their symptoms. It places people at an increased risk of falls, fractures. Some of these medications paradoxically worsen cognitive impairment. They're linked with cardiovascular events, and some of these medications cause premature death or stroke. This is why it's so important today that we discuss a strategy for appropriate medication use, and particularly a strategy for the appropriate use of psychotropics, because these are vastly overprescribed to older adults. In fact, this is a global problem. So in Canada and Belgium, the rates of overprescribing of medications in general to older adults are quite high. The rates are highest usually among older adults living in nursing homes, and in fact, psychotropics and antipsychotics are vastly prescribed in nursing homes in both our countries. Often they're more prescribed to women, people living in rural regions, or people of a lower socioeconomic status. In Canada, we recognized that we had a problematic use of medications among older adults, and two geriatricians discussed with colleagues and members of the public the creation of a network to address overprescribing among older adults. And this is the network that I took over about 2 years ago. Originally, the network was funded through public grants for research, and one of the first actions was to launch a public awareness campaign across Canada. So this is a picture of some of our members, and this is the Canadian Medication Appropriateness and Deprescribing Network. It was formed about 9 years ago, and at the time it was called the Canadian Deprescribing Network, and it was really focused on the health of older adults. Since that time, we've expanded, and we now deal with the appropriate use of medications for all ages. So you can see how the problem can compound and expand across the ages. It isn't just a problem now for older adults. Many of our younger people are taking multiple medications as well. The network is a group of clinicians, educators, people with lived experience, community leaders, policymakers, and researchers. And our mission is to produce, share, and apply information to promote the safe and appropriate use of medications. We held our first stakeholder meeting in 2015, and we asked what needed to happen to develop a national initiative to improve appropriate prescribing and who needed to do it. And I will argue that for Belgium, many of the people who need to do it and how we need to do it will be in this room today, and we'll work together in the workshops this afternoon. And perhaps you will look back and see this symposium as your first meeting where you all got together and decided to form a similar network. In 2017, members of the network published an ecological model that recognized that transformational change across the healthcare system required a comprehensive, synergistic, and simultaneous change of behavior across multiple stakeholder groups. And what you can see in this model is at the top, there is oversight from the government. And at the core, at the center, are members of the public, caregivers, and individual patients. While our group has focused on many different medication classes, one of the first priorities that we tackled was the use of psychotropics. I should say, too, that at the time, around 10 years ago, other groups in Canada were starting to recognize that we had problematic use of antipsychotics. For example, groups such as Choosing Wisely Canada and Healthcare Excellence Canada realized that many of the medications, antipsychotics, were being prescribed off-label. The indication wasn't really for people with dementia or behavioral symptoms. They were intended for people with schizophrenia or psychosis. And these medications were being used off-label, often to the detriment of the patient. Sometimes the medications were prescribed for longer than was originally intended, and most often, we had failed to offer a non-pharmacologic or non-medicine alternative as a first-line therapy for many diagnoses, including insomnia, pain, depression, anxiety, and again, the behavioral symptoms of dementia. We were using antipsychotics, and we continue to use antipsychotics in our nursing homes for their sedating side effects. I want to focus some more on antipsychotic medications. I mentioned that people who are prescribed them can experience significant side effects, but they can be quite troubling, especially if you're not able to express yourself. So they can cause confusion, dizziness. They can affect memory and balance, arguably two of the most important things for older adults and for ourselves, stroke and even death. However, if the clinical assessment suggests it's appropriate, people can use safer options to treat dementia and symptoms of dementia. And so groups in Canada developed what is called the appropriate use of antipsychotics approach. This approach focuses on leveraging person-centered care, and we have heard elements of this spoken about already today. But the idea is that you provide a supportive care environment for the person with dementia. You get to know them. You tailor the care to their habits and their preferences. And research has actually shown that this approach can improve the person's quality of life. It can improve safety. It improves the work-life balance of care providers and their families. By regularly investigating the possible causes of a negative personal expression or behavior, carers can try and resolve the unmet needs that the person they're looking after have. This person-centered care is usually the most successful way to avoid the use of antipsychotics, to decrease or stop them. So our organizations in Canada have partnered with several long-term care homes, and in a national ongoing collaborative, we are working on deprescribing antipsychotics in nursing homes, and over 300 long-term care homes have signed on. This is an approach that is ongoing. This is just an example of the initiative in Quebec. You can see that it's bilingual, and here it's presented in French. It's of course important to measure the impact of such an initiative. And we do have evidence that rates of antipsychotics are declining in Canada. So we see that in 2013, about 1 in 3 or 30% of long-term care residents who did not have a diagnosis of psychosis were prescribed an antipsychotic. In 2018, that number had dropped to 1 in 5 with this approach, so quite significant. I will, though, speak in a moment about the effect of the pandemic. First, I want to mention some other aspects of the network and how we advocate for appropriate prescribing of antipsychotics, psychotropics, and other medications. I mentioned that we have a public awareness campaign, but we also have a public awareness committee led by older community leaders. We also have a healthcare provider committee that disseminates and creates tools and guidelines. They created a framework for teaching the competencies of deprescribing at the undergraduate curriculum for medicine, nursing, and pharmacy. We have a research committee with over 50 affiliates carrying out appropriate use research in Canada. A bilingual website that importantly has a public-facing part to it, so that members of the public can access resources. We have also, through advocacy of people who are here today, like Justin Turner, strengthened and formalized our partnership with government. In turn, government recognized the importance of a strategy for medication appropriateness and actually became our funders. Here are some members of our Public Awareness Committee. So Bill Berryman on the left is a member, and in the middle you have Connie Newman, who is the chair. And Connie is an extremely effective speaker and advocate for appropriate prescribing for older adults. Here are some examples of the resources that we have on our website, and we have many tapering regimens, and we have guidelines for prescribers. What we are missing is we don't have a lot of resources for antidepressants, and so we've decided to make that a priority in the coming years. One of the reasons why we at our network have opted to focus on mental health is because of the significant side effects that taking, for example, antidepressants can create. So while 40% of people have an effective response to these medications, about 60% of people have a marginal or little to no response from the medication, but we don't do as good a job of reassessing that and potentially stopping the medication when it doesn't help, or assessing whether the harms outweigh the benefits. So we wrote an article on how to use antidepressants safely that we made available to the public, and we're in the process of publishing the second half of the article, which is, if you'd like to come off of your antidepressant, here is how you do that. I mentioned that the pandemic had a huge impact in Canada. Many of our older adults in long-term care died during the pandemic. We did see that rates of antipsychotics went back up during this pandemic. We isolated many of our older adults, and family members were not allowed into the long-term care home. Many older adults experienced increased loneliness, and medications were used to treat some symptoms that otherwise could have been managed non-pharmacologically. We saw that by the end of our pandemic, we had prescribed over 140,000 more seniors an antidepressant. So this is why we have chosen to make this a focus of our network in the coming years. We partnered with our sister organization, deprescribing.org, in order to create guidelines, which will soon be available, which will teach healthcare providers how to taper off and stop antidepressants. This is not emphasized in medical school, so it's something that we need to teach through continuing medical education. Of course, I need to speak to the importance of research on this topic. Rather than speak about research in Canada, I wish to highlight two initiatives in Belgium. So there is the Come On study that I'd like to highlight, which was a blended training program of local interdisciplinary meetings and case conferences. So with medication reviews in Belgium nursing homes and a multidisciplinary approach, you were able to show significant improvements in appropriate prescribing. There is another initiative ongoing right now in the community, which is looking at, again, a coordinated effort at deprescribing, so stopping, tapering, or switching to a safer class, benzodiazepines or Z drugs. And these are led by pharmacists and physicians. So these are important initiatives that have been successful or show success or promise in Belgium that will need support from the government in order to fund and scale them up. I want to emphasize the great importance of a multifaceted approach to improve the appropriate use of psychotropics and related medications. A heavy emphasis does need to be placed on the role of policymakers. All the tools and resources and research and public campaigns are critical, but they can only go so far. At a point, the government must recognize an appropriate use strategy is needed. In Canada, this happened recently. In December 2023, Canada's Drug Agency was formed, and not only were access and affordability important, but appropriate use and a strategy for appropriate use were legislated. An appropriate use advisory committee was formed. A coalition of Canadian organizations brought together to address appropriateness was also formed. And the strategy was developed by both of these committees in the coalition. Mark Holland, our Minister of Health, recognized and publicly said that Canadians ought not to be paying for medications out of pocket that are potentially harming them. So the path forward for Belgium. It's multifaceted. You will require insights into trends of use, and this will take a concerted effort. A clear national strategy for appropriate use is needed with some central coordination. Developing and funding a strategy to improve the use of psychotropics with an emphasis on appropriate use in nursing homes is needed. Multidisciplinary medication reviews will be very helpful to identify and address potentially inappropriate use of psychotropics and other medications. There will need to be access to non-drug alternatives, training of staff, audits and feedbacks, and setting attainable measurements, benchmarks, and a response to those measurements. It is, however, clear to me that Belgium is committed to innovating in the sphere of geriatric care. This symposium is evidence of that. I think that an appropriate use strategy and perhaps the creation of a Belgium appropriate use or deprescribing network could be very interesting. The first priority could be psychotropics, especially in long-term care homes. I believe that this could be very impactful for improving the health of mental health of older adults. I understood that you had your first deprescribing symposium in September, and I congratulate you for that. We don't want to sedate older adults with medications that aren't helping them and are potentially harming them. Surely this is detrimental to mental health, and we really do have the tools to succeed, and I believe that together we can do better. Thank you.